Today you are you, that is truer than true. There is no one alive who is youer than you.
That quote by Dr. Seuss reminds us that no matter what the child's exceptionality is, every child wants to be treated equally.
Five things all teachers should know about epilepsy. Know what kind of seizure the student has, how often he or she experiences seizures, and what a typical seizure looks like. As a teacher, you should be a role model for other students in the classroom. You should respond to a seizure maturely and calmly, and encourage other students to accept the child's epilepsy. You should observe the child carefully for signs of a seizure or adverse effects of a medication. Report any unusual behaviors or symptoms to the school nurse and the child's parent or legal guardian. As a teacher, you should know basic seizure first aid and have a clear emergency plan to be implemented in case a seizure occurs. Remember, the child does not want to feel different or be treated differently from his or her peers just because of this condition. We will now be discussing diabetes.
The American Diabetes Association website can be a useful tool for educating teachers about how to help students self-manage their diabetes. It is suggested to have a diabetic-friendly snack for the child in case he or she has low blood sugar during the school day. Now we are going to discuss allergies in the classroom.
Parents or guardians should be notified so they can determine in advance if a particular food item is safe for a child with life-threatening food allergies. Another option is to use non-food items instead of candy for rewards.
As a classroom teacher, how common is it to have students with these conditions?
Some of these conditions are more common than others. Every year, students in my classroom will be allergic to a variety of things, from medications to foods to even insect bites and stings. While I need to know to watch out for these things so that they don't encounter them and how to handle it if they do, it's not something, as long as we have that in mind, that we need to be concerned about daily. In regard to students with diabetes, that will happen maybe once every 4 or 5 years. I'll have a student with that condition. Usually by the time they're in elementary school, if it's been diagnosed within the last couple of years or more, it's something that they are able to manage with the assistance of our health office. Looking at students with seizures, we have students who have a variety of seizure disorders, and knowing how to handle those is very important. But again, it's not something that I'm dealing with every year.
As an educator, how do you become aware of these different medical conditions for the students in your classroom?
Each year when parents enroll their children in school, they fill out a standard health form where they can indicate different allergies their child will have. If a student has severe allergies, a seizure disorder, or diabetes, oftentimes they will have either an individual education plan, an IEP, or a 504 health plan. These plans go into detail about the history of the child in regard to the medical condition, treatments for the medical condition, safety measures to be taken, and procedures to be followed if such an event should occur.
What advice would you give a new educator coming into the field?
I would say the first thing you need to do is learn who in your class has a medical condition Depending on the severity of the medical condition, you might be just gathering information from the school nurse, or you might be reading an IEP or 504 plan and reading in detail how to handle the situation and the child's needs. You'll want to be sure to ask plenty of questions so that you have a good understanding of what might happen and also what needs to happen from your standpoint. Sometimes there is training that needs to be done, whether it's viewing a video or just refreshing yourself on some basic medical skills. You also need to have a plan in place for the child with the medical condition as well as the rest of your class. For instance, if you have a child with a seizure disorder, you will want to have already discussed with your class that there are times when the teacher might ask them to walk to a classroom that's next door. You'll want them to be able to stay calm so you in turn can focus on the child who needs help without a lot of commotion.